My name is Saini. I'm the President and Vice Chancellor of Dalhousie University, and you are watching The Deep Dive. In this episode of The Deep Dive, I speak with Dr. Lisa Barrett, an infectious disease expert from the Faculty of Medicine, along with the Dean of our Faculty of Medicine, Dr. David Anderson. They share their perspectives on the future of the pandemic. Please join me in welcoming my next guests, Dr. Lisa Barrett and Dr. David Anderson. Dr. Barrett, Dr. Anderson, it is so nice to have you here. Thank you for joining us. Dr. Anderson, you and I had a chat on The Deep Dive a few months ago, and we talked about the state of the pandemic and where it's going, and I thought it would be a good idea for us to bring Dr. Barrett in. She is without doubt a household name in this part of the country and an international celebrity actually in the area. You've been combating COVID-19 or helping combat COVID-19 throughout this very difficult period. So let me begin with you. I don't imagine that there are too many people watching this conversation who don't know who you are and what you do, but just in case, would you please tell us in your own words the work that you have been doing to combat COVID-19 infections?
Sure. Well, I'm an absolutely privileged person to have an amazing job here in Halifax as a clinician scientist at Dalhousie and at Nova Scotia Health Authority. And before the pandemic, way back when, 18 months or so ago, I was involved in doing research around HIV and hepatitis C, both in the lab, the immunology side of things, and also in the community with people who were at risk for those infections and trying to figure out really how to bring testing to them. And so that kind of combination of immunity of viruses and testing in community settings served me well at the beginning of the pandemic. And so throughout the pandemic, we've been doing both research and implementation with the Nova Scotia government on how to bring tests to people, how to get people tested for COVID, and also some work on some of the COVID-19 vaccines from an immunity standpoint. And a lot of communication work on science communication in the general public domain as well, which is a bit of a passion of mine.
Well, you're a star at it, so
Thank you.
It's great that you have the expertise and the passion, and that shows.
Thank you so much.
Dr. Anderson, last time you and I spoke about the subject, we were discussing how the pandemic might end and where we would emerge through this journey. Now that was a few months ago. Has anything changed since then? Do you see anything different today? And what does it look like for us to eventually get to some sort of a new normal, and what that new normal might look like?
So thanks for the question, Deep. I think we continue to be incredibly fortunate to be living in a part of the world that has one of the lowest rates of COVID infection, and that's continued over the 18 months of the pandemic. And I think we need to acknowledge the work that public health has done, the leadership in our province and in our region, the great healthcare professionals like Dr. Barrett who have just embraced this opportunity of taking measures to keep us safe, and of the public, the response to the public, the incredibly high rates of vaccination that we're seeing in our region, the collaboration and the cooperation around public health measures and getting tested when appropriate. All of these things have served to maintain really low rates of infection in our region. And so things are moving back towards normal. It's not normal at this stage, but it's great to see things like classes resuming in our universities, students interacting with each other in the class space, and things of that nature that we're able to safely achieve in our region because of the great work that's being done. So I think, probably like many, I didn't think it would take this long to move along this far in the process, and I had hoped that things would be back to normal by this point in the pandemic. But I think circumstances have shown us that we've got a ways to go. But with the measures that have been taken, getting people vaccinated, getting them to follow other appropriate public health guidelines like we're doing at Dalhousie, can allow activities to safely resume and get people back together again, which is really incredibly important for all of us.
You know, I would say that the vaccines have been quite at the heart of it, and I can't imagine that we could have been anywhere close to where we are today without the vaccines being available. There are those of us who don't quite know fully how these vaccines work, and so my question to both of you is, walk us through how the vaccines, particularly these modern ones, how do they work? How do they work against this virus? How can they help us balance between the advances in the vaccine and the spread of the virus on the other hand that we need to control? And how effective will they continue to be against the new variants that keep emerging all the time?
Dr. Anderson, would you like to start?
I'd absolutely like you to start, Dr. Barrett.
So this is, nothing short of almost close to miracles, the way we've advanced. We have a new pathogen, completely new in humans, totally different type of coronavirus, and within 18 months, we have in parts of the world, not all of the world, unfortunately, but in parts of the world, greater than 75% of the population vaccinated with a highly effective vaccine. So this is an amazing feat of scientific collaboration and advancement, partially due to, I think, the large number of people who've worked together all over the world. So how do they work? Well, some of the vaccines that are available in Canada are more what I would call typical vaccines. They're meant to boost your immune response, number one, just like any vaccine. It's meant to develop your immune system quickly so that when it runs into a virus or other pathogen in the community, it can respond more quickly and dampen down the infection and prevent severe complications. And that's an important point because vaccines aren't magic, though. They don't prevent all infections, and they don't prevent all transmissions. So in this kind of gray period of the pandemic, it's important, and we'll come back to that in a second. The typical vaccines are more based in a virus vector, and that means that you take a virus that can cause something like a common cold, you make it very weak, and you insert part of the coronavirus we call COVID-19 in there, and then we give an injection, it boosts your immune system, you give another injection, builds the army, and then the army sits quietly in your body waiting to encounter COVID-19, where it can come to action very quickly and limit the amount of infection that you get. So that's the more typical versions. Those would be similar to the AstraZeneca version of the vaccine that's been used in Canada. So the other really exciting part of vaccine science that's come to light with COVID-19 are the mRNA vaccines. And I'm pretty sure you don't know what the brand is of your measles, mumps, or rubella vaccine, but everybody knows the brands that are mostly available of the mRNA vaccines, those from Mrna and those from Pfizer. Again, great collaborations with scientific communities. They have been trying to use mRNA vaccines for cancer therapies for many years, but they hadn't really gotten to the point of using them for infections, to prevent infections. And with this new impetus of COVID-19, that technology came to the forefront from oncology and other types of research for vaccines to prevent infections. And now we have two that are very effective, up to 95% effective, maybe down around 80s for some of the Delta variants that are coming out. But the good news about the mRNA vaccines that boost your immune system is that they're very changeable, very easy to manufacture a new version, and unlike the influenza vaccines, for example, that are very labor intensive to make, mRNA vaccines are pretty cool in that they can be made, manufactured, and changed all within the course of a couple of months if needed. So how do they work? What vaccines are available? Do they work? Are there going to be possibilities to have new vaccines against variants? Absolutely, particularly quickly with the mRNA vaccines, which have been shown in now millions and millions and millions of people to be safe and very effective.
That is, it's kind of magical listening to you talk about this thing, that these armies fighting in our body, and our army sitting quietly there waiting for the enemy to show up. And then if the enemy deploys new types of soldiers, we have ability to change what we deploy against those soldiers. Yeah, that's fantastic. Dr. Anderson, you have anything to add to that?
Well, I think, as Dr. Barrett has said, really the remarkable thing about this vaccine development and implementation is the timeline. I mean, it was less than a year between when the pandemic began and when a vaccine was approved and available. And often we think of scientific advances and how they get implemented into patient care as being more in the 10 to 15 year period to actually occur. So it is remarkable when science works with policy people and with our funders, things can happen very, very quickly. And that's been a great success story of this pandemic.
So let me continue with you. You are a leading researcher, you are a practicing physician, but you also, as Dean of our Faculty of Medicine, you are also a senior administrator at the university. So I'll ask you to wear that last hat, and let's reflect on what may happen in the future. So the pandemic will come to an end sooner or later, hopefully sooner. But the virus isn't going away. It's going to be with us for a long period and maybe forever. And could you give us a sense of how we will manage our institutions and our society in the post-pandemic period, when this very dangerous, very sneaky virus will still be around us, although the pandemic would be over? And maybe perhaps you can reflect on some of the measures we are taking here at Dalhousie University.
So I think there are a number of issues and important things that you've raised in that question, Deep. I think as the things that are lessons that we've learned and things that will come out of the pandemic as that we'll move forward with, I think one is the importance of public health and of how we interact with each other as people and as a society going forward. I think that is going to change, or it has changed, and I think it should continue to change going forward. A really simple thing is if you're sick, don't come to work, don't go to class, stay home, recover, and get better. And that's been something that has been just universally advised during the pandemic. And it's been good for COVID-19, but it's been good for many other infectious illnesses as well. So to keep our society healthy, we're going to be able to do those measures. Vaccines are going to continue to be part of the armamentarium in the future. And I think as it's advised now that we get a flu shot on an annual basis, COVID-19 may become part of that regimen. So we ensure that we protect ourselves on a go-forward basis for the variants that could really seriously impact our health and well-being. And I think although there are great advantages now to getting back together and safely doing that. And you spoke of what Dalhousie is doing now, and I think the clear messaging that we're expecting everyone to be vaccinated. We're expecting that if you're going to be indoors, you're to wear a mask and to stay home if you're unwell. And then there are opportunities for testing for those that for some reason cannot get vaccinated, or even to just for all of us. And as Dr. Barrett has said, the vaccine is not the panacea to prevent all infection. There still is the risk that people that have been vaccinated can become infected with COVID-19, and that for all of us that are interacting with people to get tested on a regular basis is good public health as well. I think all of those things are going to serve to keep our university safe as we bring people back together into the classroom and the more usual way that we function as an institution.
Dr. Barrett, you've been at the forefront of not just simply public awareness about COVID-19 and how to control it, but you actually are, deep down, a top-notch researcher. But researchers don't work in isolation, and there are teams of researchers working on this, and they're working on different aspects of COVID-19 and other related matters. Could you give us a snapshot of what has been going on that informs what you speak about and what is helping our healthcare authorities here and elsewhere move the needle forward on finding solutions?
It's been an incredible experience being a part of this, and not just myself, but I would say over 100 researchers across various institutions, but particularly Dalhousie throughout this entire pandemic. And something very interesting happened. The research mandates, funding, questions, and answers happened just as quickly as the pandemic did. And let's all be clear, that's not usually a hallmark of all academic activity, but there was amazing amounts of collaboration across vaccine work, vaccine trials, therapeutics trials, public policy, implementation of science in the community around testing. All of this information was rapidly, the questions were asked, funding was there from various public and collaborative organizations and foundations. People came together, they asked and answered questions, and then disseminated that knowledge quickly and practically to people who were making the differences in the policies in record time. And so that's been an incredibly rewarding process, but also important to keeping Nova Scotia, as Dr. Anderson had mentioned, at the forefront of the lack of infections here in Nova Scotia. So an incredible contribution, I think.
Thank you, Dr. Barrett. And let me go to you, Dr. Anderson. You had one of the prominent faculties of medicine in the country, and it's not just simply for training doctors. You guys are at the forefront of research in many of the disciplines. So from your perspective.
So I build upon what Dr. Barrett has said. It really has been a tremendous scientific success internationally, but also locally, what we've been able to achieve in our region. And we have scientists working across the continuum from discovery to implementation science that have been involved in working with around the COVID-19 pandemic and have been doing incredible work with research. I think the other thing that it really has demonstrated that's been of great value has been the collaboration between institutions. The universities, and including Dalhousie, working with Nova Scotia Health and the IWK, and pooling our resources, working together as teams to address an incredibly important issue and coming up with solutions that work for our entire region. It's been a great success.
Thank you. I can't resist drawing an analogy between what happens in a war situation and after the war, where a lot of new technologies get developed during a protracted war that then go on to serve the citizens of the world in the peacetime in different ways. And I'm very optimistic that the lessons we're learning now and things we've learned to do, they will help the humanity in a myriad ways in the post-pandemic period. So that brings me to the last question I have in mind, and I'll frame it by making a statement about my own experiences in this, managing a university through conditions under which, in my view, nobody alive on Earth has ever managed. This is all new. We went into it, and that's the first thing I told myself when we went into it last year, that we have to learn as we go. So a lot of lessons have been learned. Now, two of you work, at the frontiers of healthcare as well as public health. What have we learned from this pandemic that would inform how we deliver healthcare in the future and how we manage the status of our public health? What are the lessons we can take forward from this rather unpleasant experience that we've had? Maybe I can go to you, Dr. Barrett.
Yeah. This is a long list of things we can learn, but there are some really key core parts that I think are really important, and they do come down to public health, but also health in general and how human beings think of health as opposed to disease. Public health is a population level approach, and I think we've learned that if we don't think about populations, humans are social beings. We thrive when we're social, and put us into little boxes and we don't do well. We have underestimated systematically, systemically, and internationally the importance of public health. Outside some places like New Zealand and Australia and some of the Scandinavian countries, public health never gets funding. It's never seen as a big part of human behavior and health. And I think we've learned very much the hard way that public health should be important. But that's public and population health. I think we've also learned that if we want people to think about themselves as vectors of health for themselves and to think of themselves as empowered to be healthy and not sick, we need to give them some autonomy in deciding how and when they can actually become part of the solution to health issues, whether that's self-testing, self-determination of when they get their vaccines, choice. I think we need to start thinking about health as something that belongs to each person and not to a medical team or even a population health team. So autonomy and offering people options. And the last and final thing is that I think we'd be remiss if we thought just of the successes in Canada around vaccination and management of this pandemic. It's been an absolute disaster and continues to be in many countries that are still without the same resources we have. And I think our learning institutions like Dalhousie have the ability to lead some research and to provide resources and people and experts to help enable and empower people in other countries to be able to do this regardless of their government and the setup in their country. So those are the things I think we can take forward as we go into this, because there will be other pandemics. And maybe if we think of ourselves as powerful individual and population health people, then we'll have a different approach to it next time.
Dr. Anderson, on the healthcare side, any reflections on that side?
I think the importance of working as a system and of having a team approach and a collaborative approach to dealing with the issues around the pandemic. I think truly we've shown that as a province and as a region, the benefits of that. That's I think instrumental as why things have gone so well in this part of the world. And this applies, of course, to other health-related issues and problems. And a lot of attention obviously being focused on that right now in our region. And I think going forward, we very much look forward to being part of that solution. How do we work in that team environment to work with all individuals, including the public, to keep this region healthy and well?
Well, thank you for that. One measure of a really good conversation is that you feel a bit sad when it comes to an end, but unfortunately we are bound by time. So we'll have to bring this conversation to close for now, but I'm sure there'll be others. So thank you very much for joining me today, Dr. Barrett and Dr. Anderson. It's been not just a pleasure to talk to you, but I've learned quite a lot. Thank you so much.
Thank you.
Thank you so much for joining us on this episode of The Deep Dive. If you enjoyed this episode, be sure to like this video. And if you are a regular subscriber, we will see you in the next one. Until then, I'm Saini, and this has been The Deep Dive.